YouTube, welcome to Dr. Vibes. In this video we shall study Venipuncture, but please make sure to subscribe the channel.
We will have some sterile cotton over here. First of all, we have to clean the space from where, clean the veins, clean the area from where you are going to draw the blood. Usually, we go for the antecubital fossa. Other than that, sometimes it is not recommended though. If from peripheral veins you cannot draw blood, then you go for the femoral. But other than that, for this purpose, we go for the antecubital fossa and draw blood from there. Any prominent vein, you have to make the vein prominent. What are the procedures for that? Before that, you will take the spirited cotton and while washing the space, the site of blood drawing, you don't have the drape or anything for blood drawing purpose. While washing, just wash it from center to periphery. Very easy, because from periphery if you go center, then you are just introducing the dirt, drawing the dirt from the periphery to the center. So from center to periphery in a rubbing fashion, you clean the space. Okay. After that, you will have the tourniquet with you. Tourniquet you will have to keep with yourself. You will bind the tourniquet just 1 inch above the antecubital fossa and bind it in such a way that with one draw of hand you can take it out. It is not that difficult. After that, you ask the patient to clench the fist. Anyway, these are the managers to make the veins prominent. Okay, clench the fist, tap the area. Then you can palpate the vein becoming prominent. Usually, while drawing for blood, we go for the veins that are palpable rather than it is more palpable, so it is easier. So visible vein, but if it is palpable, then it is easy. Okay. After that, Dada will give you, Dada or Didi, next year will be becoming interns. They will give you a long list of blood to be drawn. So don't go for the 10 mm. If you are going for the 10 cc syringe, the needle is also very pain inducing. So you can go for the 10 cc syringe so that you will draw a lot of amount of blood on the first time. But use a 5 mm needle water. Okay. Just for the purpose so that you are not giving too much pain. Also, sometimes when a patient is admitted for a longer time, then just explain that this much blood I am going to draw, and these are the tests that I am going to do. This is easy. After that, this will also be provided to you in a sterile way. So your assistant or co-intern will open and then you will take it. After that, see the needle. If you can. This needle has a bevel end. So while introducing, most of the cases we will see that the bevel end we are putting inside the vein. We are putting it inside the vein.
The bevel end will be facing upwards and that will be introduced into the vein first.
Yes,
that causes less trauma. Okay.
So the bevel end will be put upwards. After that, we will introduce the vein. Introduce the needle into the vein. If you are reaching the vein, then a blood drop will come into this hub. This hub, blood will come. So you know you are in the vein. So you will go to this drop will come. You will provide some negative suction and easily the blood will be drawn inside. Okay? Have a piece of cotton ready in your hands. When the blood is inside, you will, after the blood is drawn, you will take out the tourniquet with one hand, because I have not tied it that hard. After that, take the cotton and put it on the patient's hand. If the patient can, in a position, we will ask the patient to hold the cotton in one hand and flex it for 1 to 2 minutes. Sometimes in other laboratory you will get to see that when you are drawing the blood, they will attach the continuous with the syringe, and while you are drawing the blood, the continuous will get filled. But here it is not, that provision is not marking over here some reagent inside. So this is citrate, that is EDTA. There is a marking. Here you see this is a marking over here. On cloth vial, the marking is quite up here. So be very cautious while filling up the EDTA vial and the citrate vial that you fill up to the mark. You are giving more the blood. It is not in the proportion with the reagent given, so the result will be coming faulty. So this I have explained to you that this is your blood is drawn over here. So you will put your syringe inside and the blood will go. Some
don't
cases
have to push the piston.
you don't
It
have
has
to.
a negative pressure, the blood will automatically flow in. Okay? আলাদা করে যদি তুমি forcibly inject করতে যাও, there occurs hemolysis. So you might be getting a erroneous result. Right? আর ব্লাড ড্র করার আগে একটা জিনিস এনশিওর করবে, কতটা ব্লাড তোমাদের লাগবে সেটা যেন মাথায় থাকে, কত ml ব্লাড কোন কন্টেনারে দেবে সেটা যেন মাথায় থাকে, এবং এই কন্টেনারগুলো যাতে লেবেল থাকে। ব্লাড ঢেলে দেওয়ার পরে তারপর লেবেলিং করলাম, সেটা না করাই ভালো ফর ইওর ওন সেফটি। খানিকটা ব্লাড ড্রিবল করলে অ্যারাউন্ড দ্য ওয়ালস অফ দ্য কন্টেনার, তারপর তুমি লিখতে গিয়ে তোমার বডির কন্ট্যাক্টে এলো, দ্যাট ইজ নট গুড।
Before going for the blood drawing procedure, you have to label your vials. And some things are important. The PGTs will tell you that your name, the registration number, these are unique to the patient. So you at least the name, bed number, and the registration number you have to write. Label the vial beforehand, going for the sample collection. Because after this, there will be some dribbling, as sir has said. After that, when your blood collection is done accordingly in the appropriate vials, you will have to discard the needle. So before you used to get the needle burners, things like that, but nowadays the biomedical waste management has become very active in all over the government hospitals. So you know the sharp objects. For the sharp objects, where do you dispose? White box with the solutions given over there. We dispose the needles accordingly.
So let me summarize the process of venipuncture, that is drawing of the blood. For any medical procedure, ensure that you have followed all the prerequisites, the video of which has been uploaded in my channel. The second step is drape the area which contains the vein from where you are going to draw the blood. Third step is tie the tourniquet, make the vein prominent. The fourth step is take the needle, gently insert the tip of the needle into the vein upwards. Ensure a drop of blood coming there, which says that yes, the needle has gone into the vein. Next step is to the capillary action. The 5 ml or the 10 ml syringe gets filled with blood. Take the appropriate amount of blood, gently push out the needle and release the tourniquet. Next, put a piece of cotton onto the area from where the blood has been drawn. Thereafter, take the vial, appropriate vial, and insert or draw the blood into the vial. Lastly, don't forget to dispose of the needle, the syringe, in appropriate dustbins based on the biomedical waste management. This completes the entire procedure here.